it's really my privilege to be the moderator of this because it's very rare that you get two CEOs of two hospitals in one sitting together. I'm slightly nervous, but I think it'll be a very insightful session. So I don't think I should do the introduction. I'll let you introduce yourself. So, Prof.
Introduce myself. I'm sorry the session was delayed because I actually had a bit of a stressful event this morning.
Prof, they didn't know it was delayed, but okay.
So I was thinking maybe it's fate. I shouldn't be here, But they managed to squeeze me in, so I'm here in front of you. I actually have a lunch at 12. So in terms of stress, right? But you know what? It's good stress. What is good stress? Good stress is something that helps us perform better, be motivated, and really get us on our feet. So you guys were talking about productivity and all that. It really it's a very important point. So we can talk about that later.
Yeah.
As the CEO of MHF, I'm a psychiatrist actually, and my job has been clinical in nature. But now I have to look after not just the mentally ill or the severely mentally ill. I also have to look after a staff of 2,500, and then I've got a even higher mandate, right? How can we help make Singapore a happy place? So that's my job.
Thank you. Thanks for being here. It was really stressful for him, and he still made an effort to be here. So thank you very much. Yiming?
Thank you.
Oh, yeah.
Thank you. We're glad that Prof made it. Yeah, because I was also very stressful. Wondering when our turn will come. We talk about stress. I run Mount Elizabeth Hospital in Orchard. So for those of us who are in the healthcare administration, fortunately, from a stress point of view, I'm one of the few who can claim every day when I go to work and run a hospital, my hospital is in the shopping belt. So it's kind of a stress reliever. Yeah, so for colleagues, the doctors and the healthcare workers who work in Mount E, you would tend to feel that there's a different feel to it because just across the road is Paragon, so on and so forth, right? So I always like to say that welcome to a hospital within the shopping belt. Although I won't pay you enough to shop at Paragon every day, but at least being close to it gives you a different motivational aspect of things. I think also very heartened. I was listening to the earlier conversations. There's a lot of talk on productivity. And I think in the last 10 years, mental well-being and mental health from the company coverage perspective has actually evolved tremendously. And many companies today have benefits actually to cover that part. And there are actually data and scientific methodology that can be applied today. 10 years ago, that was something that was not there. And I think many providers like us struggle at even making sense on how we should provide mental health services.
Right. Thank you. Thanks, Yiming. So on that, how would you say is the support in Singapore now in terms of mental health in the entire healthcare ecosystem? Maybe, Prof, from your perspective, what is the local support or scene like for mental health now?
Locally, I think today we've been moving up the... let me start by talking about the dimensions of mental health. So where I come from, we're talking about the mentally ill. This is a pathological process in your brain, all right? So psychiatrists deal with neural network problems. And these, a lot of times, they are congenital or environmentally driven. Stress, traumatic stress, bad stress can cause mental illnesses. But this occurs only in Singapore. The last prevalence survey, 1 in 7 persons, about 13.9% of the population, have a lifetime risk of developing a mental illness. On the other hand, and in some countries it's 1 in 5, up to 25 to 20%, depending on 1 in 4 or 1 in 5, depending on which country you're looking at. But that's not the whole population. What about the rest? Mental health is not just about mental illness. Mental health is about managing stress and coping with it. Between good stress, tolerable stress, and traumatic stress. Now, traumatic stress is often bad, particularly if it's prolonged, chronic, sort of unexpected. It will result in some kind of specific brain disorder. So, taking that aside, I mean, overall, the 80% of the population, they need some help with coping with stress. And coping with stress is not, it's not like, I want the most, what's the word? The best way to deal with stress. There isn't a best way. It's very personal. It is like meeting your needs and your expectations. And each one of us has different needs and expectations. In the old days, dealing with stress could be just, where is my next meal coming from? Today, it's what's my job like? Do I have meaning? How do I feel about myself? Have I actualized? And there are a lot of spiritual level thingies that come out, as you think about what's that level of need. So that's mental health. There is a third category of in the dimension, which is very often hidden. Mental health and mental illness are often seen as bad things because they're not easy to explain. Why does a person walk off in the middle of a meeting and shout at someone or throw things at people? Why do people kill themselves? Why do people act and behave in unreasonable ways? These things are often hard to explain, and people like not to explain them, and therefore they stigmatize this. If this person can't manage himself, he's a bad person. Let's just avoid him. I don't want to work with this kind of person. But the reality is that mental health affects all of us, and from time to time we have stress. How do we handle that stress? And do we need to be stigmatized? So those are the things I call the dimension. So with that, where's the mental health landscape? I think mental illness, we're dealing with it. It's still highly stigmatized. Mental health, maybe we are not dealing with it as well. It's not that we didn't have systems to deal with it. Employee assistance programs have been in existence for a long time. But now you have the opportunity of mass customization. You have an ability to go to the ground at scale, whereas in the past, you had to give them a telephone number or something, and maybe they'll call. I guess that's Intellect's solution.
Thanks for promoting. That was not part of the script. Yiming, do you have anything else to add to that?
Yes. Mount Elizabeth Hospital is part of a global network of healthcare facilities under IHH. In Singapore, we have 4 hospitals. We have Parkway MediCentre, which is almost a hybrid, where you have a primary care as well as our specialists and diagnostic services, and of course with our primary care network. I think Prof talked about dimensions of mental health. I will probably take it from the dynamics of healthcare in the private sector. I think in private healthcare, a lot of access to healthcare is dependent on your payors, right? Who pays for your healthcare bills? And as a result, it becomes kind of fragmented, all right? Some mental health conditions actually can be managed within the community in the primary care setting, for example. But what we see in the private sector is they go straight to, say, a psychiatrist. And because you see a psychiatrist is managed at the tertiary level, and then the hospital environment comes in, and as a result, you can see the overall bill size is unnecessarily up. I think we all have to recognize whether it's public or private healthcare, mental health is a spectrum. There are 2 parts from my personal point of view. One is knowledge and self-awareness. I think these 2 things are important because once you have better clarity, and information and education is much more available today, and not to give Intellect more advertisement, but Intellect does give a kind of access to healthcare, all right, or even information that didn't exist, as I said earlier, 10 years ago. Because for the cultural stigma perspective, Intellect does give you that confidentiality, a direct access from your own personal point of view without even, say, first stepping into a physical facility for care. And that probably gives many people, hopefully, a better insight and understanding and adoption of this whole idea of mental well-being. Hopefully, at the end of the day, from a private sector point of view, is we envision that mental well-being or mental health care can eventually become like health screening many, many years ago, right? We do health screening because we want a better understanding of our own health condition. If everyone takes eventually the same perspective from a prevention point of view, I think that we have gone there in terms of the mental health ecosystem, and hopefully the current support from all the payors, insurance, company benefits, so on and so forth will continue to support that journey. And I do imagine there will be a time like today where most companies actually have health screening benefits, right, in various formats. There will be a time where mental well-being and mental health would become a real feature of healthcare, corporate benefits. And I think that will encourage a different form of access to healthcare in the private sector.
Right. Thanks, Yiming. And actually, that nicely leads to my next question. And maybe, Yiming, you can take it first. As a healthcare operator and a leader, who, in your opinion, should be responsible then for patients' mental well-being? You mentioned people going in direct to tertiary when actually it could be managed at the primary care. We talk about, companies. Who, in your opinion, is responsible for patients' mental well-being?
Okay, I think mental well-being is slightly different from a typical medical condition, if I can put it that way, right? If I'm having a fever, I feel it. I know where to go. I see a GP doctor. But if I have some mental condition which I may not be aware, right, I'm not going to do anything, right? So I think in the spectrum of mental well-being, it's important for us to have family members, co-workers, supervisors, be able to identify some risk factors, no matter how severe they are, and hopefully that triggers some activities. So I would say the responsibility, yes, in healthcare we always say is the patient's responsibility. But I think in mental health care, it may not be very clear in the domain. We may need some social community support where even family members are trained to be able to not just identify, but able to manage around this, and then access to healthcare will then be appropriate.
Right, thank you. And Prof, do you have anything to add to that?
I was just going to say that the responsibility can still be individuals, but at the point where it moves from mental health, which is about well-being, ultimately the ultimate mental health is happiness and joy, right? And that should be self-directed. But at some point in illness, and particularly severe illness, that's where what Yiming says about the person not being sort of having the capacity to be self-aware, and then it's the people around them. So I think there needs to be mental health literacy in companies. It's quite key as part of the development of a company to be to have all your staff being mental health literate, and that needs some degree of training. And just like how many of you can do CPR, cardiopulmonary resuscitation? Hopefully, there's some of you, right? And that's important if you also have the equivalent for mental health, right, in your companies, so that you can say, hey, look, this guy needs to see a psychiatrist, which is very expensive. You're right, because there's only 300 of us around, and then maybe this one needs somebody to support them.
Okay, then quick show of hands. How many of you are certified mental health first aiders? All right, not too bad. Okay, if you want to find out more about mental health first aid, you can also approach the Intellect booth later. This is a bit of a hard sell. Okay, we're going to zoom into the individual organizations now. And I think I'm going to go into IHH Healthcare first. IHH Healthcare has a commitment to care for good. How does this commitment translate into the organization's efforts to enhance mental well-being of its stakeholders? And by stakeholders, I mean patients, but also employees and partners.
Okay, thank you for the question. I think it's important. No secret, since COVID is all in the news, healthcare workers burnout, morale issues, I think it's real. I think at the onset, when we look at care for good, one of the key pillars is care for people, right? Caring for people, and we have this age-old belief and principle for all leaders in any industry. If you care for your people, your workers, they will ultimately perform their task well. And in this case, it should be transferred to better care, safer care for the patients. I think in healthcare it's much more critical because a healthcare professional who may not be motivated or distracted can actually bring harm to the patient indirectly and inevitably. And as leaders in healthcare organizations, that's actually our key trust. And if we do that well, there are various tactical things. We are also an organization just like any companies that we have. So we have access to mental health services. We have Intellect, right? We in fact, here's a bit of a hard sell, right?
I feel like I manage my partners very, very well. I should get a raise for this.
I was going to tell Cassandra she didn't have a hard sell because, Intellect and Parkway College, we have a collaboration. Mental health first aid is actually being trained by Parkway College. And the reason I'm trying to say is not because of Intellect, but because the first class of trainees are actually the staff of IHH. Why? Because if we equip our employees with the skill sets to recognize risk, colleagues at risk, and in healthcare is much more prevalent, then hopefully that effect becomes the culture, and caring for patient becomes part of this whole equation. So we want to believe that if we do this properly, the equation will be balanced. And in healthcare business, unlike most businesses, we cannot market. I cannot say we have the best hospital and best this and that. So what translates out of this is word of mouth. good care outcome as well as a safe care environment for our patients. That's how we believe in it.
What about your patients then? Are you doing anything for your patients? Because you are a physical hospital, right? So how do you bring mental well-being in?
Yeah, okay. Tough question. Earlier, someone asked me, actually, Prof is from IMH. You're from Mount Elizabeth Hospital. What are you doing here? I say in healthcare, there's, as we all agree in mental well-being or mental health care, there is a big spectrum. So that I will probably approach this from two parts. One is a tactical approach and one is a structural approach. Maybe I start with the easier one, which is structural. I mean, one of the real reason is Mount Elizabeth Hospital actually has a psychiatric ward. So we're a little bit like IMH, but of course I would say that the complexities of the cases that we undertake are not as complex as IMH. So different demographics, different needs, but fundamentally still a psychiatric ward, right? So the kind of care environment that we're put in is not what you see as a private patient coming into private healthcare. We do put up infrastructures, fixtures that are safe for patients across the spectrum in mental health. And then we have our psychiatrists who are accredited to the IHH system who will come by to the ward and take care of the patients. Now, the other part is probably more tactical. All right, I think, again, not to hard sell, but probably easier to come from my mouth than Cassandra's mouth, is intellect again. All right, we do have a collaboration at Gleneagles Hospital, which we're evaluating and probably expanding it to the rest of the hospital for pregnant moms. After delivery, there's access to mental health services through the Intellect platform. And I said tactical because as a healthcare provider, pregnant mothers delivering babies is like a matter of fact, right? It's just one of those OBGYN kind of specialties that we're talking about. But what we typically and normally would forget is they come with their own stress. Some are first-time mothers, a family background, so on and so forth. So what we have worked with Intellect, in this case, post-delivery, they have the access to care. So it makes the whole tactical approach much more complete. Not everyone is going to use it, but if you know it's available, all right, then you'll probably be curious and at least you have a channel of access to the needs at the end of the day. So this is something I feel is much more scalable, all right? It is today piloted in the pregnancy domain, but I'm sure there are other palliative care services that maybe medical oncology patients, the families need to be part of this whole support ecosystem in the community and the family. There are many, many more opportunities that I feel we can do for our patients in this aspect.
Thank you, Ming. And shifting gears a bit to Prof, I know that there is a study between Duke-NUS and IMH on the economic impact of depression and anxiety, and that has garnered a lot of attention. And quite frankly, quite a lot of partners actually sent that article to me. Can you share what the reason behind this study might be, and what are some of the key insights?
Just maybe before that, a quick rejoinder. I mean, I don't want to be balanced. Okay, Intellect is not the only product in the market, as you know, right? But it is the right way to go for digital mental health. I think it's important that we, and the point that Yiming was talking about is integration. Healthcare and services are targeted at pathology, at illness, and illness is troublesome because it affects people in significant ways. But when you go to the health side of the spectrum, this really affects the majority, most of us. Everyone here has a stake in it, and we have a chance to improve it. So whether we, as healthcare organizations, sort of do this at our institutions where we are dealing with patients, obviously we need to integrate. Physical and mental health needs to be integrated. There is a need to think about that way rather than have separation. But unfortunately, in Singapore, we have a mental hospital like ours. It's highly stigmatized. We're trying to see how we can change some of that. Then to that point about the economics of mental illness, mental illness is in many ways a little worse than physical illness because there is, apart from the impact of the illness on the individual, what we call the burden of disease. It causes absenteeism, it causes presenteeism, it causes just lowered productivity and even no productivity because they are not able to work. There's a slight slippery slope down, and that's why the cost is so high. And there is a cost to society because even though not all of us will develop mental illness, many of us will know someone who does. It could be a colleague, a family member. And how do we make this a more inclusive society? So we have to think about that. But perhaps in the delivery of care, creating some of that democracy across physical and mental health may reduce the stigma, but also improve the care. Because you know what? 30% of patients with mental illnesses actually develop the most common disorders that we are talking about at a high rate. 30% of them develop diabetes, hypertension, and lipid disorders. So just dealing with the physical health, you can't divorce it from the mental health. And that's why it's important moving forward. And it's not the psychiatrists that need convincing about mental health. It's actually the physicians and the surgeons who need to learn about how to deal with mental illnesses because it's right up their alleyway. So there are two sides to it, right? One, overall population, we need to make sure that we got good mental health going, things that lead us to joy and happiness. And that's partially connected with social compact. What our leaders are going to lead us into the next generation, 5G, 6G, 7G, and whatever G you've got. But also, how do we deal with illness as a whole? It needs to have an integrated approach.
Thank you. I guess we are a bit time, right? But I think we want to end with one question for both of you. And since we have the good honor of having both the public and private CEO of a hospital here, in your opinion, how can collaborations between public and private healthcare sectors, for example, IMH and Mount E, further build up this ecosystem to support mental health? Maybe we'll end with that question.
Well, Mount E is always welcome to come and start an award in IMH because we have a lack of private psychiatric beds in Singapore, as you may already know. And Mount E has a branch in Tan Tock Seng area, right? So I'm open to it because actually this private-public divide is sometimes taken to an extreme. I mean, it is historical. But today, I think there is need for private care, and insurance is seeing to some of this. But obviously, we don't want to over-service. Like if someone is feeling like, my car tire puncture, call a psychiatrist, then, problem, right? So something along those lines, but some kind of integration is helpful. Yeah.
Okay, Yimeng.
Yeah, I agree with Prof. I think there's a lot of opportunity, and perhaps if I take a step away from tertiary care, I think primary care, I think the biggest collaboration between public and private is Healthier SG, we know. So a lot of synergies on how even mental health can be assessed, treated even in some of the primary physicians. I think this is one way to cast the net wide, so the accessibility is much easier rather than putting the pressure on various public institutions in the past. I think this one will allow the whole spectrum of mental health patients access, in whatever comfortable way they have. So I think that comes. I think I'll take Prof's suggestion. I think there's a lot of opportunity at the tertiary level because we do have a lack of psychiatrists. And but I think in reality, when we say lack of psychiatrists or lack of bed, we're talking about lack of capacity. As you start detecting more mental illnesses from within the community, naturally the funnel above will have to be able to support the new detections and this. I think there is this space that has not been developed. I think there's a further opportunity for us to explore that.
Right, thank you. Now, I wish we had more time. This was such a great conversation, but thank you, gentlemen, for joining me. Can we give them a round of applause, please? Thank you.